And tonight in Your America, well, it's the age of the internet, and President Obama is finding out that he can try all he wants, but he can't erase the past. Now, some comments that he previously made on health care reform are coming back to haunt him. Now, the White House spin machine is now in overdrive as they try to discredit various videos available online. Now, one of the president's aides, Linda Douglas, even went as far as releasing this video on YouTube.
One of my jobs is to keep track of all the disinformation that's out there about health insurance reform. And there are a lot of very deceiving headlines out there right now, such as this one. Take a look at this one. This one says, uncovered video. Obama explains how his health care plan will eliminate private insurance. Well, nothing could be farther from the truth. You know, the people who always try to scare people whenever you try to bring them health insurance reform are at it again.
All right, it couldn't be further from the truth. Well, let's see about that. Here's the video that she is referring to.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out.
I happen to be a proponent of a single-payer universal health care plan.
All right, there you have it. In no uncertain terms, Barack Obama caught on tape clearly stating that he supports a single-payer universal health care system. So can the White House talk their way out of this one? Joining me now is pollster, president of the Word Doctors, Frank Luntz, is back with us. Frank, as always, pretty revealing. What are your thoughts?
I'm listening to this health insurance reform. Insurance. Now, these people are messing with health care. And I got to tell you, as someone who pays attention to language, they're trying to shift the focus of the debate. It's going to affect your relationship with your doctor. It's going to affect your relationship with your hospital. If there's ever a poll-driven phrase, and I know poll-driven phrases, it's this health. And by the way, you saw Linda Douglas. She said it twice. That's all you're going to hear from the White House, because what they're trying to say is, this is not going to affect your health care. It's not going to affect your right to choose your doctor, your hospital, and all of that. It's not going to affect the time. This is bad news, Sean, because they're using poll-driven language to mislead the American people, and that's wrong.
All right, now they're also lashing out at the people that are showing up at these town halls. We're going to show you a number of these. Now, Robert Gibbs, the chief propagandist today, referred to them as being manufactured, and then, believe it or not, I have a DNC communique that went out today that literally said that people, Republicans, etc., are inciting angry mobs of a small number of rabid right-wing extremists funded by K Street lobbyists. But let's take a look at Arlen Specter and Kathleen Sebelius getting a pretty passionate, response from the crowd.
I look at this health care plan. I see nothing that is about health or about care. What I see is a bureaucratic nightmare, Senator. Medicaid is broke. Medicare is broke. Social Security is broke. And you want us to believe that a government that can't even run a cash for clunkers program is going to run 1/7 of our U.S. economy. No, sir. No.
Does that seem manufactured, like an angry, inciting an angry mob? Is that a good way to handle what's going on at these meetings?
Well, the first thing, that language that you used to describe it, the K Street lobbyists, the inciting an angry mob, once again, this is as poll-driven and poll-tested. They're trying to make this into the American people versus lobbyists, and I assume that the American people understand that it really isn't that case. This is a battle between the average American and Washington, D.C.'s takeover of health care. But I want to make a point also about Medicare, because that woman raised that point. Sean, do you realize that they are going to divert funding that was intended for Medicare to help pay for this health care takeover? I think if seniors saw this, and I've done a lot of work for seniors, and I respect their contribution to American society, and I think it's wrong for money that was allocated to them to be diverted to this healthcare takeover.
Well, I got to tell you, the other thing that they're doing, Frank, as part of a strategy, and I want you to comment after this next group of tapes I'm going to show you, is they also, and it's poll tested, they're going after, quote, the insurance companies as if government's going to run it better. Let's go to the state of Missouri. Swing state, important state in any election. Let's look at, first of all, Congressman Carnahan and then Senator Claire McCaskill. Let's roll that tape.
Also, that over 10 years it would create a $6 billion surplus. So, it's important that we all listen to that. It's important important that we listen to one another. And
Nancy Pelosi, Harry Reid, and the rest of the people in Congress and the Senate, are they going to be willing to be on the same plan they're asking us to be on?
I mean, listen to those crowds, angry mobs, manufactured. That seems organic and real to me. What are your thoughts?
I think it's organic and real, but I do want to make this point, and I think it's important, that these are elected officials. They are our senators and our congresspeople. And I think it's important that we treat them with respect and civility.
But Frank,
even if we disagree with their point of view. Sean, this is important. I understand the anger because I'm moderating focus groups. We're going to be bringing something to you next week. I hear that anger. But when it's an elected official, even if we disagree with them, I would hope that we would treat them with respect and dignity.
That's fair, but how about the DNC referring to the people that are showing up as saying that they're angry mobs? How about them being respectful to them? When Robert Gibbs says that when a veteran confronted Congressman Bishop in Long Island, is he part of an angry mob? Is that manufactured, or is this real passion that people have? How about the respect for them to people?
Sean, you're right. This is real passion. We see it in all the polling. We see that not only is Obama's support dropping in terms of health care, but the intensity of opposition is increasing.
Right.
And so these people do feel passionate. But there's a better way to express it than shouting down a member of Congress.
Well, let me ask you, this is Democrat Lloyd Doggett. Let's see if you think that the crowd handled this one good. Let's roll the tape. Just say no. I mean, you know, yes, we can. Just say no. It sounds like right out of the Obama playbook.
I think that they should be listening. I think that instead of the Obama people going negative and attacking the motives of those who are hostile to his position, I think that the Democrats need to listen to this opposition, need to understand that the public is rejecting specific components of this healthcare reform. While they still do embrace healthcare reform, they don't want the specifics, and they ought to pay more attention to this frustration and stop trying to demonize those who oppose what the President and Congress are trying to do.
All right, Frank Luntz, always good to see you. As appreciated.
Thank you.
Great analysis. We'll look for those dials next week. And coming up, the attorney.